Hi, happy Thursday. Welcome back to Facebook Live. I'm Dr. Annette Mercatante, and I'm off the screen. Not sure why. Okay, we'll just do that. And we're going to start out, as always, with some data and some general updates, and then we'll get right to your questions. So our status report is the cumulative number from the onset of the pandemic of March of 2020, close to 20,000, 19,580 total cases, with 19,000 plus recovered, but 443 deaths. We are starting to see deaths coming back in. We had a nice summer with not a lot of deaths reported, and that is starting again, unfortunately. Increases in hospitalization, 818 total. And we are also seeing a slight increase in hospitalizations in our county. Statewide, they are also reporting increase in hospitalizations and emergency use for COVID-related disease. So our changes in the last 7 days, we have an average number of tests about 338, but a 10.4% positivity rate. And we're staying above 10% pretty consistently now. And we're getting a 40 plus new cases per day on the average. Next slide. So this is the slide I think we need to keep an eye on. Notice the dramatic difference in this curve from the late winter, early winter curve. So this is interesting. We're going kind of a steady upward climb. Where we'll stop or plateau is uncertain. Different modeling would suggest that we're going to plateau off and maybe stay up for a while. Other modeling could be consistent to other states where we'll see a shift very high. So we'll just continue to watch that and report on it. Next slide. And our overall vaccinations continue, but as you can see, they're starting to decrease. About 400, I can't see, oh, I have it here. About 406 first-time doses in the past week, and that's the week ending on 9/11, Hospice Day. And we'll continue to promote vaccine. Obviously, we have vaccine issues coming up. We have the booster dose that's being considered tomorrow by the ACIP. We have pediatric dosing that's going to be considered soon. And so we'll have lots to discuss about vaccines. And I think that'll hopefully drive that number up even higher. Still not nearly as many people vaccinated as we need. We have a question about combining vaccinated with total cases, and I'll talk about why that's a little problematic to do in our talk. Next slide. I wanted to share this with you. We do get weekly updates from the state. As you can probably figure out, the data mining here is overwhelming. Some data sources are inconsistent, and some data we really don't have a good way of pulling it. We get a lot of questions, for instance, about age ranges, and sometimes that data is just not readily available to us, but we do get these updates, and this was a new update that the state is starting to release as of last week. Because we have some school districts that are masking and some that are not, we have a unique opportunity in the state of Michigan to really look at that and say, does masking reduce cases? Now, we get into the whole conversation of whether reducing cases is worth it. We are taking the stance that disease is bad, and we don't want people to get infected if possible. So we are looking at this data, very interesting, as you know, because we have not entered into a mask mandate decision at this point in time. So you can see that in the state of Michigan, we have a difference in mask mandates. 229 have it and 304 do not. And I think the proof's in the pudding. Let's go to the next slide. And again, this is preliminary data. You don't make solid decisions based on one single review of the data, but this is the initial one that we've been seeing, and that is schools reopening. Cases in children are increasing, and rates are higher in the counties where school districts are not masking. Okay, and there's a lot of epidemiology that goes into this, and things that statistically could make this more or less reliable, but certainly the trend is there that we have the course of the school reopening. We do have more cases. There's a higher percent increase in cases in those schools that are unmasking. So we'll keep an eye on this. And as I've said multiple times, our decision to mask will hopefully be generated from what the schools are experiencing. Because if they mask, we have greater opportunities to keep kids in school, which is the goal, right? To keep kids in school and also to not allow them to get sick, of course. All right. Dashboard. I did want to remind everyone we're getting lots and lots of emails and calls. How come you don't do this? Show us this number. Why we want this number to be done. And what we are going to do, we're going to try and respond to all questions, but we don't want to respond to the same questions over and over again. Each question can take literally hours and hours of labor from our informatics person and from our team. So we will post those frequently asked questions on our website, on our FAQ website. That information is also posted on the county website, and you can look for your questions there. And if they're not there, we will strive to get them there the following week if you send us something new that hasn't been addressed. So that's where you can find a lot of that information.
Doc?
And yes, ma'am.
I just wanted to comment on one thing about the FAQs on the website. We actually started those back on September 3rd. So those have been posted since then. Go ahead.
Okay. All right. So the talking point that we are going to share with you today is about flu. Our flu vaccine is in. We're ready to go. And we want to encourage everyone in the community to get a flu shot. Influenza last year was mild. A lot of reasons behind that, but most experts suspect that the reason we had a mild season is because everybody was staying away from each other and wearing masks. And that is a good way of preventing respiratory infections from spreading. Okay, so we had that, but we don't really know what this year's going to bring, especially since there's a dramatic difference in people's attitudes and what they're willing to do. So many providers around the county do have flu vaccine, pharmacies, your doctor's offices, and we do as well. We just ask everyone to call for an appointment to get vaccinated, and that number, of course, is 987-5300. So now is the time to get vaccinated. We are urging people to ideally be vaccinated for the flu by the end of October. So now would be the time to get it done. Okay, we're going to get to our questions. And right. Jennifer, you're going to do the MC, right?
Okay. Yep, I am. Good afternoon, everybody. These questions came in through our COVID-19 at stclaircounty.org email over the evening. And so we are going to start with those, and then we'll move to the live. First question, I don't have a spleen, and my question is, when I get the second vaccine, am I going to have more severe side effects than a person with a spleen? Normally, when I get sick, it takes me much longer to heal, and I'm very worried.
Well, there is nothing in the literature to suggest asplenia or not having a spleen would change your risk of adverse events with the COVID vaccine. So I think that would depend. We do know that some people have milder symptoms after the second dose. Some people have greater symptoms after the second dose. I can't tell you I really understand what that would be. So my suggestion is just when you get your second dose, do be prepared to maybe have a day or two where you can just drink fluids and lay low and not have to push yourself. I did want to mention though, because I was curious about this, because as you know, the current recommendations are recommending a third dose of mRNA vaccine for those who have immunocompromised conditions. And although lack of a spleen can be considered immunocompromised, I just wanted to share with the individual, or in fact, there's a lot of people that don't have spleen. So having a lack of a spleen actually increases your risk of infection of really a very specific kind of germ, a bacteria that's encapsulated. Because of what the spleen does in our bodies, it's really not associated with broad immunocompromised conditions against all things. It's really associated with increased infections with these encapsulated organisms, examples of which would be meningococcus, streptococcus, Haemophilus influenza. So those are important germs, bacteria, because we do have vaccines for 2 of those. And so that is important for people without spleens to be vaccinated. But I don't know that that's relative to the COVID. Immunocompromised conditions for COVID vaccine, I had it here, are generally things like taking medications to reduce your immune system, being an organ transplant person, having solid tumor cancers of some kind. I had the list here and I forgot it, but they are listed, and that's something that's important for you to talk to about with your doctor. And they have a list because I just sent them the same list that I just looked for. It's not worth going through. It's a lot of technical medical terms, but talk to your doctor.
All right, the next question is, why isn't natural antibodies being used in herd immunity numbers? Why are you not taking natural immunities into consideration?
Well, we are. First of all, let me just say this. If we had herd immunity, we wouldn't be seeing cases rising the way they are. Okay, herd immunity means there's enough immunity in the community to reduce the spread of the germ, and we're clearly not there. Okay, we're not there as a nation. We're not there as a state. We're not there as a county. Where the heck? I've lost my mind with the numbers. Here we go. The issue with counting the vaccinated numbers with the people who've already been infected is that we don't know how many people who've had disease went on and got vaccinated. And honestly, it's probably a substantial number of people who had natural disease, who got infected, and then when the vaccine came out, they got vaccinated. In fact, we recommend people who have COVID disease to get vaccinated because the vaccine immunity is much more reliable and sustained as far as we can tell. And the third issue is we don't know how to interpret serology. And I've said this a million times on this thing, but if you go and get a blood test for serology, there's a lot of variability still in that. As far as the type of test, what type of antibody is detecting. There's IgMs, IgGs, IgAs, there's capsid proteins and spike proteins. And so it really, serology is not there yet as a science for us to do and say, aha, you have this antibody, therefore you're immune. Because the other thing we don't know is at what level your antibodies are protective. Okay, and so this is a whole bunch of reasons why using natural immunity, which absolutely exists, we're sure of it, but how we can use that in our total discussion about what our level of immunity is. And one more thing is that natural immunity can be very spotty. We know some people mount good serology responses to infection and others do not. Some mount those serologies for very long periods of time, others do not. We don't understand why some do and why some don't. And finally, probably most importantly, remember the price you pay for waiting to get infected naturally versus developing immunity from a vaccine. The vaccine's not going to hurt you. The disease itself has a pretty high risk of landing you in the hospital or worse. Okay, so the price you pay for a natural infection is far, far higher and far more riskier. Okay.
All right, the next question is, do you have an updated COVID-19 case, hospitalization, and death rates among fully vaccinated and unvaccinated St. Clair County residents for more recent dates than August 25th?
I have my notes now. Okay. We are in the process of updating the cases, hospitalizations, and death rates among fully vaccinated and unvaccinated St. Clair residents. You guys have no idea. Maybe you do, maybe you don't. This is an amazing full-time job. We have one data person in our department course, he gets a little help from the region. We try and help him, but this is a really tough job, and I just want to kudos to you for doing this. We will publish this when they're available. Breakthrough cases can be found also at michigan.gov/coronavirus under the data and modeling updates. The most recent breakthrough data published by the state includes data from January to September of 21, September 7th, excuse me, of 21. And so that's pretty up-to-date information. And during that period, we had 5.4% of new cases, 7.9% hospitalizations, and 6% of COVID deaths that were fully vaccinated. So very small percentage of individuals who are vaccinated go on to get infected, hospitalized, or die. And that's there's a MMWR that was published today that further validates that. Although vaccines are not 100% effective, they are really great at preventing serious infection and serious illness.
And the last question that came in was, this person said, I'm really worried about my kids going to school without mask. Who do I need to talk to share my concerns? The school, the health department?
Yes. Yes. Well, you can talk to us, but we're really concerned too. Have your kid go to school with masks. So our reports are very few people are wearing masks. So all you people that are concerned, send your kid to school with a mask. They're allowed to wear a mask in school, okay? It gives them some protection. And the more people that do it voluntarily, the greater that protection. So as far as who else you can talk to, your school has the opportunity and the ability to put in masking requirements. So talk to your school, talk to your Board of Education, and the other people you can talk to, of course, are your elected officials, the people who can turn around and say you're not allowed to do that. This is a two-pronged issue. There is the science and the health issue that we try and stay in our lane as public health practitioners to provide the best information and the best guidance. But then there's the politics and the issues of contrary opinions. And so politicians need to hear from you. They need to know that there are people out there that want their kids to go to school in the safest way possible. So thank you for that.
All right, we are moving now to the live questions. It's 3:47. Normally we are here till 4, but we will stay till 4:15, Doc, if you can today.
Of course.
Okay. The first question is from Cindy. If vaccinated people can get and transmit the virus, why are quarantine steps different for them?
Because they're a lot less likely. So it is all risk assessment. For zero risk, we go to shutdown again, right? Nobody wants to do that. We need to balance keeping kids in school and knowing there's going to be exposures against uncontrolled spread of the virus. And as long as this virus is spreading, we have to try. And we're not giving up, okay? A lot of people have said to me, well, just give it up. The rest of us have moved on. You can too. No, we can't. We can't, because there's still lots of cases. And every time it starts to explode and grow, our hospitalizations grow, our deaths grow. This is worth fighting, okay? So we weigh that risk and benefit. A person's vaccinated, I just mentioned to you, has a very small risk of getting infected. Once they are infected, yes, they can spread it, but that risk is much lower. What we are asking, though, is people who are vaccinated and are not going to go through a quarantine process, that they test early on in their 14-day potential incubation period. So we are asking vaccinated people to test on days 3 to 5 and to wear a mask during the duration of that quarantine period that they might have been in, so the 14 days after their exposure, to wear a mask, to just give a little extra support and protection in case of that small percentage that do end up getting infected anyways.
All right. The next question is from Heather. When and where can people with severe asthma get a booster?
Boosters have not been approved yet, so the ACIP is meeting tomorrow again to review this and to discuss how and when people should be boosted, or if. Lots of issues here, lots of questions, and we're going to leave that to the experts. As soon as they decide, we'll let you know. And then, of course, you can reach out and get that vaccine. It'll be the same dose. And you can get it from any provider that is carrying the COVID vaccine. Okay, and I suspect it will be differentiated. The higher risk people, the elderly, people with chronic diseases will probably be prioritized, I would suspect. By the way, can I just mention one more thing? I'm going back to that. Hey, if vaccines don't work, why do we even bother? Or why should we even let them go back? I was trying to think of an analogy. This might be a bad one, but so people run red lights and they crash into other people and cause problems, but it doesn't mean we get rid of red lights, right? We still try and follow rules and try and follow processes that reduce risks to individuals. And rather than put a red light on every corner, making people not drive, we kind of try and ask people to follow rules. And then when we have a really bad corner where a lot of accidents, we reevaluate it, and maybe we put a roundabout there, or we do a different kind of traffic control. So maybe that's not the best analogy, but I just want people to think about this, what they're saying. When something isn't 100% effective, it doesn't mean you just throw it out the window. You keep tweaking it. You keep tweaking it and trying to make it work for you. And that's what we're trying to do with quarantines, right? We're trying to keep the amount of people inadvertently exposing other people to the amount of people who are out of school or out of work or having hardships because we're asking them to avoid exposure. Okay, sorry, I'm ranting.
Okay, the next is from Brianne. She said, my family is the one that lost 2 people to COVID on Saturday. The 18-year-old was from St. Clair High School and at Saints Day in the school on August 31st. Both passed away 11 days later. Are you reporting these deaths?
Sure. But first of all, I'm sorry for your loss, and I'm sorry for every single loss that this virus has caused. We count these bodies, we count these calls, and we've been getting them for 18, 19 months now. It's bad. So I'm sorry. Yes, we do count them. The process of deaths and data collection isn't immediate. So as soon as you called and we called and found out about it, it's not like it goes into our data system. There's a process where the death certificate is reviewed. It's reviewed against other potential causes of death, and then if it is deemed a COVID-related death, it would go into the system, and then it would be put into our official tally. So I don't know, is that one in our official tally yet? I'm asking my data guy. Yes, it is. He says we do have that one in. But I just want to tell you that, this isn't, I've mentioned this before, this isn't real-time data where you can kind of rely on it being absolutely accurate as we go, but in the process of weighting it and scrubbing it and analyzing it, that data becomes cleaner and cleaner over time. So we get a much better view of what's going on. But I'm pretty confident that the deaths that we have are real deaths associated with COVID infection. There may be a few outliers on there, maybe a few we missed, or maybe a few that are in there that shouldn't be, but there's not a lot. There's not a lot. So we're blessed to be in a small community where we typically find out about these things in lots of ways. Okay.
All right. The next question is from Kathleen. She said, I will be getting the booster when it's available and also the flu shot. How long should I wait between the two?
You don't have to wait between the two. You can get them both at the same time. Okay. No, and so that's been very clear. The COVID vaccine can be co-administered with any other vaccine. So do it at the same time, because then you don't have to come back. People are less likely to come back and get another shot. So just do it all at once.
The next question is from Sandra. She asked, is the new Mu variant in our county?
No, it is not. We have not received any reports in our state, I believe, right? Oh. Okay, thank you. No, Brandon's confirming. I don't believe we've had any reports of Mu in our state so far.
The next question was from Terry, and you kind of covered this from last night's question, but he said, what about natural immunity? Why don't you count those of us who are survivors and have higher antibodies than your shot coverage gives?
Yeah, well, I did cover that already. So
Okay,
we
we
do
can go
count
back.
it. It counts, all right? It counts to your body. It doesn't count. What we can't really use it as an absolute number, number of people infected, assuming that they all have immunity at this point. We can't assume that 19,000. What is the number? 19,580 people in our county have natural immunity, plus the number of people who've been vaccinated have immunity, because many of those people are the same people, number one. Number two, we don't know how many of those 19,000 people have reliable antibodies that are still protective. So it's just an impossible number to officially consider.
There's been a couple questions, Doc, and you kind of covered it earlier, but we might just want to cover it one more time. This specifically, I'll read Joe's question. He said, the Times Herald reported today that you would prefer the schools to mandate masks, and if they don't, you will when it's necessary. Are you urging or requesting schools to mandate masks or not? What is your trigger point to determine that?
Hi, Joe. Yes, I'm urging them to do it every time I talk to them, especially as we start investigating cases. If we start seeing more cases in the schools, that's another trigger point to urge them to do it. What is our trigger? If no one will do anything and things are getting worse and worse, right? So, I mean, unfortunately, we're obligated. We're like the standby. So if nobody else will stand up and do this, and I'm not throwing the schools under the bus, please. They've been great partners, and I understand all the things going on. But if that's not something that can be done and things are unraveling, then that is our responsibility as in public health is to try and provide more support for reduction in disease transmission. And if that's what we have to do, that's where we'll do it.
A couple people asked the following question, but I will go with Sandy's because she asked a kind of a two-pointer. Sandy asked, what is the total percent of vaxxed in St. Clair County? I got vaxxed in Ingham County. Am I on your list?
You would be if you live here. Okay, it doesn't matter where you were vaccinated, as long as you're not a vet, VA system is outside, or if you got vaccinated outside of our state, then you probably would not be in our system. But if you were vaccinated anywhere in Michigan, you're going to be in our MICR system, and you will be allocated to St. Clair County because that's where you live. Okay, so I got that right, right? So,
and then they want to know what is the total percentage?
Total percentage, all age groups. This is the most accurate, 53.3% of at least one dose. I was going to ask about total for fully vaccinated. That's about 49%, is it not? All ages?
They're asking for fully vaccinated.
Fully vaccinated is 49.5%.
Okay.
And that's 12 and older, all ages lumped together.
All right.
Not very good, right? It's not going to get us there, right?
The next question is from, oh, you already answered this, Frida, about the spleen. We already talked to that. So you can always go back, and we timestamp this Facebook Live video, so you can go back and everything's categorized. Just so you know. Okay. I'm just looking through here. With so many, this is from Sue.
No hate mail, okay? If it's hateful, we don't need to answer it because we're not about hate. We're all about health and well-being. Okay.
Okay, this is from Sue. She asked, with so many vaccinated, why the surge? Isn't it just as high as it was last year?
Well, you saw that graph. It's not as high as it was last year. I don't know if we want to throw that up there. And maybe that plateau that we're looking at could be a result of immunity, right? Vaccine immunity as well as natural immunity. So we'll find out. But you do remember that we have mutations of the virus, and we have the Delta virus now. So most people believe that this current surge is being driven by the variant, which is a little less impacted by the vaccine and highly more transmittable. So as long as there are individuals who are susceptible, the virus will do its thing. It's what it does. It spreads. And we have, right, so that's the point. So, we talk about how many people are vaccinated. You got to realize that corollary of that is the thousands and thousands, tens of thousands, the millions of people, in fact, in the United States who are not vaccinated, so, and are still vulnerable. So that's the long and short of it.
All right. The next question is from Amber. If it's less likely to spread while being vaccinated, then why do we have so many breakthrough cases?
No, it's not less likely to spread. If you're vaccinated and get infected, anyways, that small percentage, which is, a single digit percentage, okay? Once you're infected, you can still spread it, although there is some indication that the viral load goes down quicker if you've been vaccinated, which is maybe one. In other words, you'd be infectious a little bit for a little shorter period of time. But all that's very preliminary data. If you've been if you've been trying to wade through the vaccine serology data, God love you. There's just a ton of it. We were just talking about it. It's so hard to keep up. So, right, preliminarily, we do believe that you can still be contagious if you're infected. So, I'm sorry, the question is, I lost that again. It's less likely to spread while being vaccinated, then why do we have so many breakthrough cases? Because there's so many people who are not vaccinated. Okay, in our young adults, which is where the highest rate of increases are occurring right now. I'm sorry, people, it was the same in the fall, but it's the same now. The greatest increase in cases is in our, I believe, the 16 to 19-year-old age group statewide. At least I know that's the case. I think our data is still, again, St. Clair County data is we got smaller numbers, so it can be a little trickier, but clearly that's what we're seeing. In our age group, the 12 to 15-year-olds, only 24% of them have even one vaccine, and up to 19, only 38% of them. So a lot of people who are really susceptible still. And it's a nasty virus in the sense that it takes every opportunity it can. If it sees an opportunity to infect, it seems to be taking advantage of this, which is why none of us should take this lightly. I'm not being a fear monger. I'm not trying to, create danger when there is none. This is a really unique, aggressive virus. If we had a herpes virus that acted like this, people would be losing their minds, right? So, this is a really nasty virus that we really do need to take seriously.
All right, the next question is a comment from Spec to Cindy. She said, "Thank you, doctor, and your departments. We know you've only have our best in mind." And we certainly do.
We're trying.
Oh, Michelle asked, "Are you supposed to call to inform the health department that you're vaccinated?"
No, you don't have to call us. No, keep your vaccine card. Some people might ask you for vaccine status, certain events, certain situations. You need your vaccine card to go to Canada. You need your vaccine card to go into some events, some venues. So keep your vaccine card available. We can look up your vaccine status through MICR. We have that ability, so we don't really need you to report it. Now, if you got vaccinated outside of the state, or if you're a vet and you got your vaccine in the VA system, that might be worth a call to make sure that we can fix that for you, right? Especially if you were vaccinated in another state. You want your vaccine status to be available in Michigan, especially if you work here.
Okay. Amber, this is the last question that we have. Amber said, "That's not what you said when I asked this question. You said it was less likely. Breakthrough cases are people who are fully vaccinated who can still spread it. So why
Right.
blame the unvaccinated when it appears
Right.
that the vaccinated is also spreading? So we can't be sure the unvaccinated are spreading the virus."
So I'll just go over this again, and I apologize if I'm confusing everybody, but if you are fully vaccinated, you have a very small risk of getting infected. Okay, yep, okay, so that's a good point. So if you had a recent infection with COVID last 90 days, you also have a very small risk of being infected. Even, in fact, I would say a recent infection, we're even less concerned than a fully vaccinated person. So if you've had those two situations, we feel that the risk of infection is low enough that we can provide a little more leeway for people to kind of work and go to school with a couple of safety measures in place, like the mask and the testing. Okay, I'm not blaming unvaccinated people. I'm just saying that it's much more likely if you're unvaccinated and get exposed to a virus that you're going to get infected, and it's a much greater chance that you're going to be infected and get sick. And if you do get sick, a much greater chance that you're going to get seriously sick. So I hope that's clear. I mean, no one said vaccines are 100% panacea, but they are very, very helpful. And I will say this, if we get enough people vaccinated, we'd probably see a slowing down of transmission. And why do I say that? Because that's what we know happens. That's in the 50 to 60 years we've used vaccines. Actually, it's been longer than that. Closer to 100 years now. This is what we see with effective vaccines, that if a certain proportion of the population becomes vaccinated, the disease transmission kind of disappears. It's why we don't see measles anymore. It's why we don't see polio anymore. Has it gone away? No, but it markedly reduces the transmission. So that's what I meant, and I apologize if I was confusing about that.
Thanks, Doc. Okay, it looks like we're done with the questions. So any closing comments before we say goodbye?
Oh, I had all kinds of things in mind, and now I can't remember what I was going to say. So take care of yourselves. I've said this before. We can't do all of this for you. We can certainly guide and try and do our best to give you the best guidance. The best that we know of. The science is changing. There'll be new information as we go through this, but the best way in my mind, there's prevention. So prevent yourself from even getting exposed to the virus, right? That would mean physical distancing and vaccine are probably your two best things. Isolation and quarantine are ways that we prevent other people from getting exposed to the virus. Then if you do get exposed to the virus, reducing your risk of getting a high enough viral load that you're going to actually get sick. And that's masking, disinfectant, ventilation, right? So that's all in place in case there was an exposure and your body is less likely to get infected. And then unfortunately, the last tier of this is if you do get infected, early testing and diagnosis is helpful, especially since we do have some treatments with monoclonals that are available for outpatients with high-risk conditions. So that's your third tier. But as you may know, despite what you may be reading, there's not a lot of great antiviral treatment out there against COVID yet. We just don't have great treatment. So your best bet is to avoid infection in the first place, primary prevention, or secondary prevention, reduce the risk of getting a severe infection. Okay, we'll see you guys next week.
And I just want to remind everybody, before you cut it, Elise, remind everybody, look at our website, scchealth.co, under our frequently asked questions, FAQs
all
on
these
COVID.
questions you guys asked today are up there, okay? We've answered them, and we'll re-answer them, and we'll tweak them to keep them updated, but many of these questions are up there. Maybe it's not what you want to hear, and that's why you keep asking them, but please look at our FAQ because I think you'll find a lot of information there that you're looking for.
And I want to remind everybody, too, they can email COVID-19 at stclaircounty.org. They can call 810-966-4163. And they can watch this. Every single Facebook Live we do is time-stamped and put on our health department YouTube. Feel free to go back. We categorize
Bye, everyone.
it. See you next week.